Okay, so coronavirus is one of the is a handful of viruses that infect humans and animals. And this particular coronavirus, the virus that we now call COVID-19, is not a virus that has been seen in humans before. But what was important about the virus was that it has not been seen in humans before.
ਸੋ ਇਹਨਾਂ ਦਾ ਕਹਿਣਾ ਹੈ ਕਿ ਜਿਹੜੀ ਇਹ ਬਿਮਾਰੀ ਕਰੋਨਾ ਵਾਇਰਸ ਤੋਂ ਜਿਹਨੂੰ ਕੋਵਿਡ-19 ਕਹਿੰਦੇ ਆ ਇਹ 80% ਜਿਹੜੇ ਪੀਪਲ ਹੈਗੇ ਆ ਉਹ ਮੈਨੇਜੇਬਲ ਹੈਗੀ ਆ
Yes, we do know what it is. It's a respiratory. We don't know where it originally came from. So there's lots of things we don't know about it. We don't know.
ਸਤਿ ਸ਼੍ਰੀ ਅਕਾਲ ਐਂਡ ਵੈਲਕਮ ਟੂ ਸੀਜੇ ਸਿੱਧੂ ਸ਼ੋ। ਜਿਸ ਤਰ੍ਹਾਂ ਤੁਹਾਨੂੰ ਪਤਾ ਹੀ ਹੈ ਕਿ ਹਰ ਹਫਤੇ ਥਰਸਡੇ 7 to 8 o'clock ਅਸੀਂ ਕਿਸੇ ਨਾ ਕਿਸੇ ਪੋਲੀਟੀਸ਼ੀਅਨ ਜਾਂ ਕਮਿਊਨਿਟੀ ਐਕਟਿਵਿਸਟ ਜਾਂ ਜਿਹੜੀ ਇਨਫੋਰਮੇਸ਼ਨ ਕਰੰਟ ਇਨਫੋਰਮੇਸ਼ਨ ਹੈ ਤੁਹਾਡੇ ਤੱਕ ਲੈ ਕੇ ਆਈਦਾ ਆ। ਅੱਜ ਸਾਡੀ ਗੱਲਬਾਤ ਹੋਊਗੀ ਕਰੋਨਾ ਵਾਇਰਸ ਜਿਹਨੂੰ ਕੋਵਿਡ-19 ਵੀ ਕਹਿੰਦੇ ਆ, ਉਸ ਦੇ ਬਾਰੇ ਗੱਲਬਾਤ ਚੱਲੂਗੀ ਅਤੇ ਉਸ ਦੇ ਲਈ ਸਾਡੇ ਨਾਲ ਅੱਜ ਸ਼ਾਮਲ ਹਨ ਰੇਖਾ ਗਸਤਾਫਸਨ ਜਿਹੜੇ ਕਿ ਵਾਈਸ ਪ੍ਰੈਜ਼ੀਡੈਂਟ ਆਫ ਪਬਲਿਕ ਹੈਲਥ ਐਂਡ ਵੈਲਨੈਸ ਐਂਡ ਇਹਨਾਂ ਦਾ ਜਿਹੜਾ ਕੰਮ ਹੈਗਾ ਪਾਪੂਲੇਸ਼ਨ ਪਬਲਿਕ ਹੈਲਥ ਪ੍ਰਮੋਸ਼ਨ planning and prevention across provincial health services authority clinical programs, and she also have a leadership role with British Columbia Centre for Disease Control ਜਿਨ੍ਹਾਂ ਨੂੰ ਕਾਫੀ ਲੰਮਾ ਤਜਰਬਾ ਹੈ, ਜਿਨ੍ਹਾਂ ਦੀ ਡਿਗਰੀ ਹੈਗੀ ਮਾਸਟਰ ਆਫ ਸਾਇੰਸ ਮਾਸਟਰ ਆਫ ਹੈਲਥ ਸਾਇੰਸ ਐਂਡ ਇਹ ਪ੍ਰੋਫੈਸ਼ਨ ਤੋਂ ਡਾਕਟਰ ਹੈ ਜਿਹੜੀ ਕਿ ਇਹਨਾਂ ਨੇ UBC ਤੋਂ ਕੀਤੀ ਹੈ and she also holds a fellowship in public health and preventative medicine and certification in family medicine. Rekha, welcome to CJ Sidhu Show.
Thank you very much.
So as you know, there is a very, very big conversation or scare among the public worldwide about coronavirus. So you being a medical doctor, at the same time being involved in BC, Center for Disease Control. Tell us what this disease is.
Okay, so coronavirus is one of the is a handful of viruses that infect humans and animals. And this particular coronavirus, the virus that we now call COVID-19, is not a virus that has been seen in humans before. We were notified that there's an outbreak of pneumonia of unknown cause in China on December the 31st, 2019. Very rapidly, at that time we actually didn't know what was causing the pneumonia. That's why it was called pneumonia of unknown cause. But very rapidly, Chinese scientists identified the virus as one of a type of virus called the coronavirus. But what was important about the virus was that it has not been seen in humans before. And there are two reasons that we are very worried when we see a virus that hasn't been seen in humans before. One is that there is no level of immunity in the population. So there's nobody who has had the virus before and is recovered and had either complete or partial immunity. So we have the potential of a lot of people becoming ill. And the other is that we really didn't know at that time how this virus behaved. So when we first learned about it, what we knew is that it was a new virus. It became apparent that it was transmissible from one person to another quite easily, but we didn't know how it was going to behave.
So Rekha ਦਾ ਕਹਿਣਾ ਹੈ ਕਿ ਇਹ ਜਿਹੜਾ ਕਰੋਨਾ ਵਾਇਰਸ ਹੈ ਇਹ ਜਦੋਂ ਪਹਿਲਾ ਦਸੰਬਰ 2019 ਚਾਈਨਾ ਦੇ ਵਿੱਚ ਹੈਪਨ ਹੋਇਆ ਉਸ ਤੋਂ ਪਹਿਲਾਂ ਇਹ ਹਿਊਮਨਸ ਨਹੀਂ ਇਹ ਜਾਨਵਰਾਂ ਦੇ ਵਿੱਚ ਇਹ ਬਿਮਾਰੀ ਹੁੰਦੀ ਸੀ ਅਤੇ ਹਿਊਮਨਸ ਨੇ ਆਏ ਸ਼ੁਰੂ 'ਚ ਜਿਹੜੀ ਮੈਡੀਕਲ ਪ੍ਰੋਫੈਸ਼ਨ ਹੈ ਉਹਨਾਂ ਨੇ ਸੋਚਿਆ ਕਿ ਸ਼ਾਇਦ ਇਹ ਨਮੋਨੀਆ ਐਂਡ ਆਫਟਰ ਫਾਈਂਡਿੰਗ ਆਊਟ ਇਹਨਾਂ ਨੂੰ ਇਹ ਪਤਾ ਲੱਗਿਆ ਵੀ ਇਹ ਕਰੋਨਾ ਵਾਇਰਸ ਦੀ ਇੱਕ ਫਾਰਮ ਹੈਗੀ ਹੈ ਜਿਹਦਾ ਇਹਨਾਂ ਨੇ ਫਿਰ ਨਾਂ ਰੱਖਿਆ COVID-19. So just as a follow-up lead to that, so coronavirus and one of the forms of coronavirus is COVID-19. how they are different?
So each coronavirus behaves slightly differently. There are some very serious ones like SARS and MERS that have very high mortality rates and can cause very severe disease. The more common coronaviruses cause the common cold, the thing that you and I know as common cold. This particular coronavirus we now know, we didn't know in early January, causes mild illness in about 80% of people. About 16% of people have what we call more serious disease, so can have pneumonia, and a smaller proportion of people can have critical disease. And we do know that at this time the virus appears to have mortality rate of about 1%. Well, we also now know who's most likely to die from this infection, and it's people who are over 60 years old, but really mortality increases very sharply in the 7th and 8th decades of life, so people in their 70s and 80s, and people with chronic medical conditions, especially of the heart, and as well as diabetes.
ਸੋ ਇਹਨਾਂ ਦਾ ਕਹਿਣਾ ਹੈ ਕਿ ਜਿਹੜੀ ਇਹ ਬਿਮਾਰੀ ਕਰੋਨਾ ਵਾਇਰਸ ਤੋਂ ਜਿਹਨੂੰ COVID-19 ਕਹਿੰਦੇ ਆ, ਇਹ 80% ਜਿਹੜੇ ਪੀਪਲ ਹੈਗੇ ਆ ਉਹ ਮੈਨੇਜੇਬਲ ਹੈਗੀ ਹੈ। 16% ਪੀਪਲ ਨੂੰ ਜ਼ਿਆਦਾ ਹਰਟ ਕਰਦੀ ਹੈ ਤੇ ਫਿਰ ਏਜ ਜਿਹੜੀ ਹੈਗੀ ਹੈ 60 ਤੋਂ ਉੱਪਰ ਜਿਹੜੇ ਹੈਗੇ ਆ ਉਹਨਾਂ ਨੂੰ ਇਫੈਕਟ ਕਰਦੀ ਹੈ, ਖਾਸ ਕਰਕੇ ਜਿਹੜੇ 70 ਜਾਂ 80 ਸਾਲ ਦੇ ਉਹ ਤੇ ਜਾਂ ਕਿਸੇ ਨੂੰ ਸੀਰੀਅਸ ਜਿਹੜੀਆਂ ਆਲਰੇਡੀ ਬਿਮਾਰੀਆਂ ਲੱਗੀਆਂ ਆ, ਹਾਰਟ ਦੀ ਪ੍ਰੋਬਲਮ ਹੈ, ਉਹਨਾਂ ਨੂੰ ਇਹ ਜ਼ਿਆਦਾ ਹਿੱਟ ਕਰਦੀ ਹੈ। ਸਾਡੀ ਫੋਨ ਲਾਈਨਸ ਓਪਨ ਹੈ, ਪਲੀਜ਼ ਫੀਲ ਫਰੀ ਟੂ ਕਾਲ and ask Rekha any question you might have in your mind, and we will keep on talking about it. Coronavirus COVID-19 ਜਿਸ ਦੇ ਕਿ ਹਲੇ ਤੱਕ ਜਿਹੜੇ ਕਰੰਟ ਸਟੈਟਸ ਹੈਗੇ ਆ ਸਾਰੀ ਦੁਨੀਆ ਦੇ ਵਿੱਚ 97,683 ਪੀਪਲ ਨੂੰ ਇਹ ਹੋ ਚੁੱਕਿਆ ਵਾਇਰਸ, ਤੇ ਜਿਸ ਦੇ ਵਿੱਚ ਦੁਨੀਆ ਦੇ ਵਿੱਚ 3,382 ਡੈਥਸ ਹੋਈਆਂ, ਜਿਸ ਤੋਂ ਵਿੱਚ ਸਾਰਿਆਂ ਨਾਲੋਂ ਵੱਡਾ ਹਿੱਸਾ ਚਾਈਨਾ ਦੇ ਵਿੱਚ ਹੈ। ਚਾਈਨਾ 'ਚ 80,000 ਦੇ ਕਰੀਬ ਲੋਕਾਂ ਨੂੰ ਇਹ ਵਾਇਰਸ ਹੋਇਆ ਹੈ ਤੇ ਜਿੱਥੇ ਕਿ 3,000 ਤੋਂ ਉੱਪਰ ਉੱਥੇ ਮੌਤਾਂ ਹੋ ਚੁੱਕੀਆਂ। ਅਮਰੀਕਾ ਦੇ ਵਿੱਚ 145 ਕੇਸਿਸ ਡਾਇਗਨੋਸ ਹੋਏ ਹੈ, ਜਿਹਦੇ 'ਚੋਂ 12 ਡੈਥਸ ਹੋਈਆਂ। ਕੈਨੇਡਾ ਦੇ ਵਿੱਚ ਰਾਈਟ ਨਾਓ 36 ਕੇਸਿਸ ਕਨਫਰਮਡ, ਬਟ ਥੈਂਕਫੁਲੀ ਦੇਰ ਇਜ਼ ਨੋ ਡੈਥ। So in Canada, we are relatively prepared, or you guys, where we stand in preparation?
Well, I think in Canada we have some really good advantages in terms of preparation. In fact, Canada has done a lot of preparation and development since the SARS outbreak in 2003. One of the things that Canada was very well poised to do is to do enough testing to detect the virus early. In British Columbia, for example, there are some regional variations, so not every region has the same capacity to test, but I can give you an example from British Columbia. In British Columbia, as I mentioned before, the virus, we were notified of the virus in late
I think we have more cases in British Columbia, isn't it, relatively speaking, in Canada?
We have Ontario and British Columbia have the highest number of cases in Canada. That's likely because they include large metropolitan areas where we have more travelers from areas that were affected earlier in the outbreak. We also have the ability to detect it. Within 10 days of the publication of the genetic code of the virus, we were in British Columbia ready to test for it. And we've had testing very widely available. So we do have more cases than some other provinces, but at the same time, we also really have had the ability to test and detect and find them.
ਸੋ ਇਹਨਾਂ ਦਾ ਕਹਿਣਾ ਕਿ ਮੈਂ ਕਿਹਾ ਕਿ ਆਪਣੇ BC ਦੇ ਵਿੱਚ ਕੈਨੇਡਾ ਦੇ ਰਿਲੇਟਿਵਲੀ ਜ਼ਿਆਦਾ ਨੰਬਰ ਹੈ ਜਿਹੜੇ ਕੇਸਿਸ ਆਲਰੇਡੀ ਆਪਣੇ ਜਿਹੜੇ ਆ ਪਤਾ ਲੱਗੇ ਆ ਨੰਬਰਸ, ਪਰ ਉਹ ਕਹਿੰਦੇ ਕਿ ਸਾਡੇ ਕੋਲ ਟੈਸਟਿੰਗ ਜਿਹੜੀ ਹੈਗੀ ਉੱਥੇ ਬੈਟਰ ਹੈਗੀ ਹੈ, ਤਾਂ ਕਰਕੇ ਸਾਨੂੰ ਜਿਹੜੀ ਉਹਦੇ ਡਾਇਗਨੋਸਿਸ ਛੇਤੀ ਹੋ ਜਾਂਦੇ, ਪਤਾ ਲੱਗ ਜਾਂਦਾ ਵੀ ਕਿਹਨੂੰ ਇਹ ਬਿਮਾਰੀ ਹੈਗੀ ਹੈ। ਬਾਕੀ ਕੈਨੇਡਾ ਇਹਨਾਂ ਦਾ ਕਹਿਣਾ ਹੈ ਕਿ SARS ਤੋਂ ਬਾਅਦ ਪਹਿਲਾਂ ਹੀ ਪ੍ਰੀਪੇਅਰਡ ਸੀਗਾ, ਐਂਡ ਇਸ ਕਰਕੇ ਅਸੀਂ ਕਾਫੀ ਇਸ ਮਾਮਲੇ 'ਚ ਪ੍ਰੋਐਕਟਿਵ ਹੈਗੇ। ਸੋ ਹੈਵਿੰਗ ਸੈਡ ਦੈਟ ਰੇਖਾ, looking at the picture, the scare, or medical professional worldwide or World Health Organization as well, did they pinpoint actually what this disease is?
Yes, we do know what it is. It's a respiratory. We don't know where it originally came from. So there's lots of things we don't know about it. We don't know where the disease first originated, but we also know a great deal now. Yes, we know exactly what the virus is. We actually have a very good sense now of the spectrum of illness. In other words, we know that children appear to be quite spared. There aren't a lot of infection in children and in young people. And we know that the majority of infections are among people over 30 years of age, and it's much more serious in those who are older and who have complex chronic medical conditions, which is actually quite typical of a coronavirus. We do know that coronaviruses in general have the tendency and the ability to infect and cause severe disease in those with chronic illnesses and those who are older.
ਸੋ ਇਹਨਾਂ ਦਾ ਕਹਿਣਾ ਕਿ ਜਿਹੜੀ ਡਿਸੀਜ਼ਨਸ ਇਹਨਾਂ ਨੂੰ ਕਾਫੀ ਇਨਫੋਰਮੇਸ਼ਨ ਹੈਗੀ ਹੈ ਜ਼ਿਆਦਾਤਰ ਇਹ ਸਾਹ ਦੀ ਜਿਹੜੀ ਹੈਗੀ ਹੈ ਤਕਲੀਫ ਉੱਥੇ ਜ਼ਿਆਦਾ ਹਿੱਟ ਕਰਦੇ ਆ ਪਰ ਜਿਹੜੇ ਬੱਚੇ ਹੈ ਹਾਲੇ ਤੱਕ ਜਿਹੜੇ ਚਿਲਡਰਨ ਹੈ ਦੇ ਆਰ ਨਾਟ ਇਫੈਕਟਡ ਬਾਈ ਦੈਟ ਮੋਸਟਲੀ ਜੇ ਕੋਈ ਇਫੈਕਟਡ ਹੋਇਆ ਦੇ ਆਰ ਓਵਰ ਏਜ ਆਫ 30 so talking about that before we talk about precautions people can take are they medical community worldwide or came up with a solution or vaccine or medication to fight that?
So we don't have a vaccine yet. The one is in development, but vaccine development does take a while. So for example, getting a vaccine within a year would be a very, very fast time to get a vaccine. There are some antiviral medications that we're doing experiments that are being used as an experimental treatment. But given that the virus is new, there are no proven medications because the virus has only been known to us for 2 months. But what we do know is there are certain things that really do make a difference. And one of the things that we know makes a difference is identifying cases early and having people who are sick stay at home and having their close contacts, especially household contacts, stay at home for 14 days until we can make sure that they do not get ill. We now have evidence that actually makes a difference in making the epidemic less severe in a community and to prevent transmission to others.
So ਇਹਨਾਂ ਦਾ ਕਹਿੰਦਾ ਕਿ ਜਿਹੜੇ ਆਇਡੈਂਟੀਫਿਕੇਸ਼ਨ ਜਿਹੜੀ ਹੈਗੀ ਹੈ ਉਹ ਸਾਰਿਆਂ ਨਾਲੋਂ ਪਹਿਲਾਂ ਬਹੁਤ ਜ਼ਰੂਰੀ ਹੈ ਜੇ ਕੋਈ ਪਤਾ ਲੱਗ ਗਿਆ ਵੀ ਕੋਈ ਫੈਮਿਲੀ ਦੇ ਵਿੱਚ ਇਹ ਬਿਮਾਰੀ ਹੈਗੀ ਹੈ they should stay home and other family members should stay home as well, right?
That's right.
And ਉਸ ਤੇ ਫਿਰ ਇਹ ਹੈ ਉਹਦੇ ਸਪਰੈਡ ਦੇ ਜਿਹੜੇ ਚਾਂਸਸ ਹੈ ਕਾਫੀ ਜਿਹੜੇ ਘਟ ਜਾਂਦੇ ਆ we have a question.
Okay.
Yes, caller, you are online.
Hello. Hi, doctor. I just wanted to know that is it safe to travel in Asian countries specifically, and if somebody is traveling, what are the precautions one can take before travel?
So if you're traveling in any country, including Asian countries, the Public Health Agency of Canada actually has travel advisories that tell people exactly what precautions they ought to take. At this time, there's level 3 advisories, which means that you should avoid non-essential travel to the Hubei province of China, to Iran, as well as northern Italy. In other parts of the world, the other countries, there may be a level 2 advisory, which means that you should take some precautions, make sure you wash your hands frequently, and avoid crowds. Whichever country you plan to travel to, though, it is worthwhile going to that website, going to the Public Health Agency of Canada Travel Advisory website, and that will give you very specific advice on where it is safe to travel right now. The reason I recommend that you go to that website is because this is a rapidly evolving outbreak, and the advice today may be very different from the advice 2 weeks from now.
How about India?
Yeah.
How about India?
Right now in India, there aren't very many cases reported at the moment from India. The last time I believe it was 30 cases. One of the things,
31, yeah.
Yeah, one of the things though to keep in mind is that reported cases also depend on how much testing there is occurring in a country. Having said that, thus far, we have a lot of traffic between Canada and India, and we haven't had importations from India at this point.
There's a one case happened in Canada that somebody traveled I think through Hong Kong or China.
So there are some people who have traveled to India, but they've also had many other opportunities in other parts of the world to potentially be exposed. So although we have had some importations from Iran, some importations from China, we have not had importations from India.
ਸੋ ਇਹਨਾਂ ਦਾ ਕਹਿਣਾ ਕਿ ਇੰਡੀਆ ਤੋਂ ਹਲੇ ਜਿਹੜਾ ਕੇਸ ਹੈਗਾ ਉਸ ਦੇ ਬਾਰੇ ਟਰੈਵਲਰ ਐਡਵਾਈਜ਼ਰ ਦੇ ਬਾਰੇ ਕੋਈ ਮੈਂਸ਼ਨ ਨਹੀਂਗਾ, ਪਰ ਟਰੈਵਲ ਐਡਵਾਈਜ਼ਰੀ ਜਿਹੜੀ ਗੌਰਮੈਂਟ ਦੀ ਉਹਨੂੰ ਦੇਖ ਕੇ ਤੁਸੀਂ ਆਪਦੀ ਜਿਹੜੀ ਟਰੈਵਲ ਬੁੱਕ ਕਰਾਉਣਾ ਆ। ਅਤੇ ਜਿਹੜਾ ਸਾਰਿਆਂ ਨਾਲੋਂ ਜ਼ਿਆਦਾ ਜਿਹੜਾ ਕੰਸਰਨ ਹੈਗਾ, ਜਿਹਨੂੰ ਲੈਵਲ 3 ਆਪਣੇ ਟਰੈਵਲ ਐਡਵਾਈਜ਼ਰੀ ਕਹਿ ਦਿੰਦੇ ਆ ਵੀ ਨੋਨ ਐਸੈਂਸ਼ੀਅਲ ਜਿਹੜੀ ਟਰੈਵਲ ਹੈ, ਜੇ ਤੁਸੀਂ ਨਾ ਜਾਓ ਉਹਦੇ ਵਿੱਚ ਚਾਈਨਾ, ਇਟਲੀ ਅਤੇ ਈਰਾਨ ਆ, ਉੱਥੇ ਜੇ ਜਾਣਾ ਉੱਥੇ ਤੁਸੀਂ ਅਵੋਇਡ ਕਰੋ। ਫਿਰ ਸੈਕੰਡ ਲੈਵਲ ਐਂਡ ਥਰਡ ਲੈਵਲ ਦੀਆਂ ਜਿਹੜੀਆਂ ਕੰਟਰੀਜ਼ ਹੈਗੀਆਂ, ਸੋ ਇਹਨਾਂ ਦਾ ਕਹਿਣਾ ਕਿ ਟਰੈਵਲ ਐਡਵਾਈਜ਼ਰੀ ਦੇਖ ਕੇ ਅਤੇ ਫਿਰ ਤੁਹਾਨੂੰ ਟਰੈਵਲ ਕਰਨਾ ਚਾਹੀਦਾ। ਐਂਡ ਐਟ ਦ ਸੇਮ ਟਾਈਮ caller called, and what other precautions people should be considering being a proactive and not spreading the disease?
So I think especially people who are older or who have chronic medical conditions, they should consider the risk if they are about to plan travel, because the world is very connected, and if they are going to travel to an affected area, they should consider the potential risk and potentially postpone travel. The other thing, of course, is that to avoid crowds, to make sure you clean your hands frequently and avoid touching your eyes, and stay away from people who you know are sick. So I think those are very common sense precautionary measures that you can take anywhere at any time to prevent respiratory illnesses. And really the prevention measures for coronavirus or COVID-19 are the exact same as they are for other respiratory illnesses. We know that washing your hands frequently is effective. And again, to stay away from people as much as possible who are sick.
ਸੋ ਇਹਨਾਂ ਦਾ ਕਹਿਣਾ ਕਿ ਜਿਹੜੇ 80+ ਜਾਂ ਜਿਨ੍ਹਾਂ ਨੂੰ ਕੋਈ ਕਰੋਨਿਕ ਡਿਸੀਜ਼ ਹੈ ਉਹਨਾਂ ਨੂੰ ਜਿਹੜੀ ਟਰੈਵਲ ਅਵੋਇਡ ਕਰਨੀ ਚਾਹੀਦੀ ਹੈ। ਲਾਰਜ ਕਰਾਊਡ ਜਿਹੜੇ ਅਵੋਇਡ ਕਰਨੇ ਚਾਹੀਦੇ ਆ। ਹੱਥ ਧੋਣ ਦੀ ਗੱਲ ਬਹੁਤ ਸਾਲਾਂ ਤੋਂ ਚੱਲ ਰਹੀ ਹੈ ਕਿ ਰੈਗੂਲਰਲੀ ਜਦੋਂ ਤੁਸੀਂ ਕੋਈ ਚੀਜ਼ ਟੱਚ ਕਰਦੇ ਆ ਜਾਂ ਬਾਹਰੋਂ ਘਰੇ ਆਉਂਦੇ ਹੋਏ ਆ ਜਾਂ ਤੁਸੀਂ ਕੰਮ 'ਤੇ ਆਪਦੇ ਹੱਥ ਜਿਹੜੇ ਆ ਸਾਬਣ ਨਾਲ, ਗਰਮ ਪਾਣੀ ਨਾਲ ਚੰਗੀ ਤਰ੍ਹਾਂ ਧੋਣੇ ਚਾਹੀਦੇ ਆ। ਸੋ ਉਹ ਜਿਹੜੀਆਂ ਚੀਜ਼ਾਂ ਹੈਗੀਆਂ ਆ ਉਹ ਤੁਹਾਨੂੰ ਇਸ ਨੂੰ ਬਿਮਾਰੀ ਤੋਂ ਤੁਹਾਨੂੰ ਬਚਾ ਸਕਦੀਆਂ। The another thing, I have a very good relationship in a medical community, my best friends in America. So I was speaking to them today a little bit. I knew it that I'm doing a special on this one. So they were saying, and the American friend of mine, he said in America every year 25,000 people die because of normal flu.
That's right.
And he said that, and these deaths are nowhere close to that number. So what is our roughly approximate Canadian number, and why is the case, and why is a big fuss about this virus?
So absolutely, seasonal influenza kills several thousand Canadians every single year. We know that as well, and it infects a large part of the population. So why are we so concerned about this? I do think that there's an element of the unknown, and because with influenza we actually know to expect the influenza season. We have a vaccine to prevent influenza. We have some treatments for influenza, and the mortality rate, so the risk of actually dying of influenza is much lower for an individual, but because so many people get infected with influenza every year, thousands of people do die from it. So I think, I don't think that means that we shouldn't be worried about COVID-19. I think we should be more worried about influenza than we are. And influenza vaccine is a really, really important prevention method that is available to us. The reason we're worried about COVID-19 is because, again, unlike influenza, which comes every season, and we know how many people it's going to infect more or less, we really didn't know what the impact of this virus could be. We actually have a better idea now. I think it's still very important to try and contain it and to try and delay the introduction to any country and to take the precautions that are sensible, that are reasonable. But I also think that we are in a much better place now than we were even a month ago. We know that the vast majority of people will have a mild illness from which they will recover without any intervention at all.
ਸੋ ਮੈਂ ਇਹਨਾਂ ਨੂੰ ਪੁੱਛਿਆ ਸੀ ਕਿ ਜਿਹੜਾ ਨਾਰਮਲ ਫਲੂ ਹੈ ਅਮਰੀਕਾ ਦੇ ਵਿੱਚ ਮੇਰੇ ਡਾਕਟਰ ਫਰੈਂਡਸ ਉਹਨਾਂ ਨਾਲ ਗੱਲ ਹੋਈ ਸੀ ਕਿ 25,000 ਬੰਦਾ ਉੱਥੇ ਮਰਦਾ ਅਕੋਰਡਿੰਗ ਟੂ ਡਾਕਟਰ ਰੇਖਾ ਇਹਨਾਂ ਦਾ ਵੀ ਕਹਿਣਾ ਆ ਕਿ ਇੱਥੇ ਆਪਣੇ ਕੈਨੇਡਾ ਦੇ ਵਿੱਚ ਕਾਫੀ ਡੈਥਸ ਹੁੰਦੀਆਂ ਪਰ ਉਹ ਕਹਿੰਦੇ ਫਰਕ ਉਹਦਾ ਇਹੀ ਹੈ ਕਿ ਇੱਥੇ ਜਿਹੜਾ ਇਨਫਲੂਐਂਜ਼ਾ ਹੈਗਾ ਆ ਉਹਦੇ ਬਾਰੇ ਸਾਨੂੰ ਪਤਾ ਆ ਉਹਦਾ ਟਰੀਟਮੈਂਟ ਸਾਨੂੰ ਪਤਾ ਆ the thing is with the COVID-19 they don't exactly know how to handle that and that's why they don't want that to be spreading to other countries. We have not believe it I have 3-4 minutes left of your part of the show and in a summarized way our viewers what will be your message based on being a professional being involved in this file and let them know what precaution they take, why they don't, because right now it's epidemic, it's not pandemic declared by World Health Organization. I think what will be your advice to our viewers?
So my advice to viewers is that use common sense. This is a respiratory virus. It does tend to have more serious consequences for people who have chronic medical conditions. So take the precautions that we always tell you to take. Wash your hands. Stay at home when you're sick, both for the benefit of your family and your friends, but also your community. Stay at home when you're sick. Wash your hands frequently. And if you have more severe symptoms, call ahead to the clinic to let people know that you may be, that you're concerned about your health so that they can take precautions. Take the travel advice, listen to travel advisories, follow the travel advisories. But other than that, I would say that it is actually has become part of our world now. We need to take precautions. We need to take it seriously. But we also have many other things that we need to look after. We need to look after our families. Many people with chronic illnesses need to take their medications. And then the last message that I'd like to say is that just be kind to each other. Make sure that limit stigma. Don't assume that you think somebody could have coronavirus because of how they look, what language they speak. We're all in this together. And I think the really important thing actually is to stay at home when you're sick. If you're an employer, if you're a co-worker, please help people stay at home when they're sick.
ਸੋ ਇਹਨਾਂ ਦਾ ਕਹਿਣਾ ਹੈ ਕਿ ਜਿਹੜੇ ਪ੍ਰੀਕਾਸ਼ਨ ਹੈ ਆਲਰੇਡੀ ਮੀਡੀਆ ਦੇ ਵਿੱਚ ਪੇਪਰਾਂ ਦੇ ਵਿੱਚ ਸਾਰੀ ਜਗ੍ਹਾ ਆਪਣੇ ਹੈਗੇ ਆ ਕਿ ਆਪਦੇ ਜੇ ਤੁਸੀਂ ਬਿਮਾਰ ਹੋ ਸਟੇ ਐਟ ਹੋਮ ਬਿਕਾਜ਼ ਇਟਸ ਈਜ਼ੀ ਟੂ ਸਪਰੈਡ ਦੈਟ ਅੰਟਿਲ ਯੂ ਗੈਟ ਵੈਲ ਜਦੋਂ ਠੀਕ ਹੋ ਜਾਓ ਫਿਰ ਠੀਕ ਹੈ ਕਾਮਨ ਸੈਂਸ ਜਿਹੜੀਆਂ ਚੀਜ਼ਾਂ ਹੱਥ ਧੋ ਆਪਦੇ ਹੈ ਨਾ ਜਦੋਂ ਤੁਸੀਂ ਸਨੀਜ਼ ਕਰਦੇ ਆ ਯੂਜ਼ ਯੂਰ ਆਰਮ ਨਾਟ ਯੂਰ ਹੈਂਡਸ ਐਂਡ ਕੀਪ ਅ ਪ੍ਰੋਪਰ ਡਿਸਟੈਂਸ ਵਿਦ ਪੀਪਲ ਐਂਡ ਇਹਨਾਂ ਦਾ ਦੂਜਾ ਵੀ ਜਿਹੜੀ ਬਹੁਤ ਵਧੀਆ ਗੱਲ ਕਹੀ ਹੈ ਕਿ ਸਰਟਨ ਕਮਿਊਨਿਟੀਜ਼ ਦੇ ਬਾਰੇ ਤੁਹਾਨੂੰ ਥੋੜ੍ਹਾ ਸਟਿਗਮਾ ਹੈਗਾ ਕਿ ਉਸ ਕਮਿਊਨਿਟੀ 'ਚ ਸ਼ਾਇਦ ਜ਼ਿਆਦਾ ਇਹ ਬਿਮਾਰੀ ਸੋਕਦੀ ਹੈ be nice to them. It's not necessarily Canadians are Canadians and just use it. Common sense travel advisory ਜੇ ਇਹਨਾਂ ਕੰਟਰੀਆਂ ਜਿਹੜੀਆਂ ਅਫੈਕਟਡ ਆ ਉਹ ਪਹਿਲਾਂ ਗੌਰਮੈਂਟ ਉਸ ਦੇ ਬਾਰੇ ਕੀ ਕਹਿ ਰਹੀ ਹੈ ਉਹ ਦੇਖ ਕੇ ਤੁਸੀਂ ਜਾਣਾ ਆ ਸੋ ਐਨੀਵੇਜ਼ the final last question how prepared you are in British Columbia about this disease, how well you are prepared and in a larger scheme in Canada, but British Columbia, you're responsible for BC.
Well, I think we're actually quite well prepared in British Columbia, and parts of the healthcare system that are going to feel pressure if there are a lot of people who are sick are preparing very, very actively right now. People are looking at what's essential, what's not essential. I think one of the biggest stressors that could happen to the healthcare system is that if a lot of healthcare workers get ill at the same time. We all know that our healthcare system is looking after a lot of people. It needs to be very responsive, and any pressure on the healthcare system can have significant delays for some of the care that we must provide. And I think that's probably the most important thing that we want to plan for, and we're actively planning for, is to make the healthcare system resilient so that if you need surgery, if you have cancer, if you're about to have a baby, we can provide you the highest level of care, even in the midst of a COVID-19 outbreak.
ਸੋ ਇਹਨਾਂ ਦਾ ਕਹਿਣਾ ਕਿ BC ਦੇ ਵਿੱਚ ਅਸੀਂ ਕਾਫੀ ਪ੍ਰਿਪੇਅਰਡ ਹੈਗੇ ਆ, ਪਰ ਜਿਹੜੀਆਂ ਐਸੈਂਸ਼ੀਅਲ ਬਹੁਤ ਜ਼ਰੂਰੀ ਜਿਹੜੀਆਂ ਕੈਂਸਰ ਹੈਗਾ ਆ, ਹਾਰਟ ਅਟੈਕ ਕਿਸੇ ਨੂੰ ਹੈ, ਕਿਸੇ ਦੇ ਬੇਬੀ ਹੋਣਾ, ਉਹ ਸਰਵਿਸਿਜ਼ ਜਿਹੜੀਆਂ ਅਸੀਂ ਪ੍ਰੋਵਾਈਡ ਨੂੰ ਪ੍ਰਾਇੋਰਟੀ ਦੇਣੀ ਹੈ। ਉਸ ਦੇ ਨਾਲ ਨਾਲ ਜਿਹੜੇ ਕਿ ਹੈਲਥ ਕੇਅਰ ਵਰਕਰ ਹੈ ਉਹ ਵੀ ਮੇਕ ਸ਼ੋਰ ਕਰਨਾ ਹੈ ਕਿ ਦੇ ਸਟੇ ਮੋਟੀਵੇਟਡ, ਕਿਉਂਕਿ ਉਹਨਾਂ 'ਚ ਜੇ ਸਪਰੈਡ ਹੋ ਗਿਆ ਤਾਂ ਫਿਰ ਉਹਨਾਂ ਦੂਸਰਿਆਂ ਨੂੰ ਸੰਭਾਲਣਾ ਮੁਸ਼ਕਿਲ ਹੋ ਜਾਣਾ ਹੈ। ਸੋ ਰੇਖਾ, thank you very much for such a short notice. You came here and shared your thoughts on our viewers. Maybe in a couple of weeks, maybe have another session and then we can address our audience. Thank you very much for coming.
My pleasure.
ਸੋ ਇਹ ਸਾਡੀ ਗੱਲ ਚੱਲ ਰਹੀ ਸੀ ਰੇਖਾ ਗਸਤਾਫਸਨ, ਜਿਹੜੇ ਕਿ BC ਸੈਂਟਰ ਫॉर ਡਿਸੀਜ਼ ਕੰਟਰੋਲ ਤੇ ਇਸ ਤੋਂ ਇਲਾਵਾ ਵਾਈਸ ਪ੍ਰੈਜ਼ੀਡੈਂਟ ਫॉर ਹੈਲਥ ਐਂਡ ਵੈਲਨੈਸ ਵਿਦ ਪ੍ਰੋਵਿੰਸ਼ੀਅਲ ਹੈਲਥ ਸਰਵਿਸਿਜ਼ ਅਥਾਰਟੀ, ਜਿਸ ਦਾ ਕਿ ਮੇਰੇ ਨਾਲ ਵੀ ਵਾਸਤਾ 8 ਸਾਲ ਬੋਰਡ ਮੈਂਬਰ ਦੇ 6 ਸਾਲ ਮੈਂ ਬੋਰਡ ਮੈਂਬਰ ਦੇ ਤੌਰ ਤੇ ਉੱਥੇ ਰਿਹਾ ਹਾਂ। ਸੋ thank you very much. And ਇਸ ਤੋਂ ਬਾਅਦ ਪਲੀਜ਼ ਆਫਟਰ ਕਮਰਸ਼ੀਅਲ ਸਟੇ ਟਿਊਨ ਇਨ ਯੂਰ ਔਨ ਆਪਣੇ ਡਾਕਟਰ ਗੁਲਜ਼ਾਰ ਚੀਮਾ, ਜਿਹੜੇ ਕਿ ਤੁਹਾਡੇ ਨਾਲ ਪੰਜਾਬੀ ਦੇ ਵਿੱਚ ਇਹ ਸਾਰੀ ਇਨਫੋਰਮੇਸ਼ਨ ਦੇਣਗੇ। ਸੋ ਪਲੀਜ਼ ਸਟੇ ਟਿਊਨਡ ਇਨ ਡਾਕਟਰ ਗੁਲਜ਼ਾਰ ਚੀਮਾ ਆਫਟਰ ਸੈਕੰਡ ਹਾਫ। ਉਹ ਤੁਹਾਡੇ ਰੂਬਰੂ ਹੋਣਗੇ ਤੇ ਉਹ ਕਰੋਨਾ ਵਾਇਰਸ ਤੇ COVID-19 ਦੇ ਬਾਰੇ ਗੱਲ ਕਰਨਗੇ। ਧੰਨਵਾਦ।